These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.
Good morning, everybody. Welcome to another session of the Health Hour brought to you by the Caribbean and African Health Network. My name is Dr. Yusuf and I'm a GP based in Leicester, and I'm just going to be hosting the session today. We've got a very exciting topic. We always have an exciting topic, to be quite honest with you, but this is, one that is quite close to a lot of us and how we view ourselves physically as people with darker skin color. And we have the pleasure of Dr. Chiedu, who is a dermatology consultant in training, to take us through this important topic of how we can celebrate our melaninated skin more. But more importantly, the risk that comes with things like bleaching. Nowadays, people don't use bleaching much anymore. They call it toning, which is a subtle way of saying we're still trying to appear fairer than we're supposed to be, and obviously this has become very common with a lot of aesthetics, celebrities, all these things on social media about how people look, and we perceive they look better when the skins are fairer. Now, what are the downsides of this habit? What can it cause to our skins in the short term and in the long term? How does it affect us? And what is the side effects that comes with all this looking good on the outside? And there are other ways that we can make our skins look good without going through all this chemical routes. And I'm just going to invite Dr. Chiedu to take us through all those questions as to how we can enhance our skin, how we can look good without going through the chemical route, but more importantly, what is the downside of using these chemicals on our skin? As for people that are new to the show, the way it usually happens is we have a presentation. After the presentation, we have time for questions and answers. Now, anytime I've done the hosting, I usually say the questions come towards the end. Now we wrap up the session by 11:50, 11:55. So please put your questions in the chat box as soon as they come into your head. Nothing is silly, nothing is, there's no silly questions. It's better we get it answered than you having these questions, and then you're not quite sure what to do. We have, the pleasure of having somebody who is has a lot of knowledge in this field, and I think this is a good place for you to ask the questions. So we have the presentation, but while the presentation is going on, please, you can put your questions in the chat box. If you join us from social media, put it in the chat box as well. We'll pick it up from there. Before Dr. Chiedu comes on, I'd like you to just type in the chat box where you're joining us from, because we've had some interesting locations in the past, and we've had people from the Caribbean, from Nigeria, so I want to see the furthest place we have today. So feel free, don't be shy, put in the chat box where you're joining us from today. Also helps us to know any specific geographical reasons, where some of these presentations will be more, will be more relevant to you. So we've got Salford from Manchester. Thank you, thank you. Well, Salford, I love Salford. Yes, you could either love or hate Salford, if you know what I mean. Milton Keynes, thank you, Viva. Kent, yes, thank you, Tanwa. Anybody else? I'm sure we have more than three people in here with us today. People on social media, please. Yes, I am right. I know Salford. People on social media, yes, please let us know where you're joining us from as well. We want to, we're not only here for people in the UK, we want, all, Caribbean and African people. So it'd be nice to know, how far our messages is reaching out. Hertfordshire, thank you, Caroline. That's, that's amazing. Thanks for joining us. Anybody else wishes to share? Anybody out of the UK? No? Anybody from Scotland? Maybe? Ireland? No, we're not there yet. I'm sure they will join in. I'm sure they will. Thank you, everybody, who's shared with us so far. I'm still looking at the chat. I'm still expecting to see some more, exotic locations, really. People in the sun, people, people, people in the sun. Okay, let's not waste time. I'm just without much ado, I'm going to invite Dr. Chiedu to join, to start to introduce himself and start his presentation. Thank you.
Okay, good morning, everybody. It's great to be back, and thanks for the great introduction, Dr. Yusuf. Um, so today we're going to talk about celebrating melanin and versus the risk of skin bleaching and toning. So as Dr. Yusuf said, I'm a registrar based in London, but also do some research up in Manchester as well. And so today we'll just go through a few things. Feel free to ask questions, and we'll start straight away. Okay, so what is skin bleaching? Now, or skin toning, should we say these days? Now, it's the intentionally using products to uniformly lighten or whiten the skin. What it isn't is medically prescribed medication to treat disorders of hyperpigmentation. And these could be stuff that's resulted of through acne scarring or melasma, for example. It's also not these cosmetic formulations that are used to typically exfoliate the skin to smoothen out texture and treat post-inflammatory skin changes as well. Okay. All right, so the history of skin bleaching, and hopefully some of you guys remember the photo on the left-hand side. No, it's not from the ancient Egyptian times, but it's Michael Jackson remembered the time. And the reason why I've chosen this photo is because we know historically that skin lightening, skin bleaching has been something that's been going on since the ancient times, through the ancient Egyptians onwards. And there's always some kind of social rhetoric behind it. More in more modern times, I guess more commercially, we know that there was always that rumor around Michael Jackson, whether he was skin bleaching, and actually he had an underlying condition called vitiligo, and that this kind of social perception in some cultures where the lighter your skin is, the more advantage you have in life. And again, on the right hand side, you can see this kind of depicted. This it's actually from more of an Indian, Asian subcontinent kind of picture, where you've got the idea that the lighter your skin is, the more opportunities, the more kind of potential life value you have compared to someone who's got darker skin. And that is something that we see in many cultures, not only in the Indian subcontinent, but in Africa quite predominantly. Even for many of us who live in the UK, quite often we'll often experience that bias due to the turn of our or the darkness of our skin. And so because of that, throughout time, there'll be different things that we use to really address um the darkness of your skin to make things to either camouflage it or to make it look lighter. Okay, so if we move on. Okay, so what has there been over time? So let's take you back to the ancient Egyptian times, and we had things like milk, honey, that was often used to try and make the skin lighter. At one point, they even used crocodile poo to help things. We've used licorice root, we've used flowers, peonies, and throughout time, the use of lead, which is a metal, arsenic, and mercury have been documented in their use. Arsenic was quite common in the Victorian times, but lead has been used in the Egyptians, the Greeks, the South Asian history of time, and turmeric as well. So it's not something new that we're talking about. It's been an issue for millennia. And I think it's something that we have to be sensitive about, but also be aware that, with everything that was done, there's those consequences. All right. So why are we concerned about skin bleaching or skin toning? Fundamentally, it's important to know that in the UK, skin agents that or products that intentionally lighten or bleach your skin are illegal. Okay. Um, that's predominantly because a lot of them have a lot of components which are dangerous to the individual and maybe to those surrounding them. They are often there's a lot of hidden side effects. There's often long lasting damage that we don't appreciate until later on. Um, in some instances, there are chemicals within the product that can also affect the family without you realizing it. And you may develop complications as well. Interestingly, which I think many people don't appreciate, is that overuse of these skin lightening products can often lead to skin cancer. And it's not skin cancer due to the sunlight, but often skin cancer due to chronic inflammation that leads to changing of the cells around that area. Um, and actually, for um, I was at a conference last week in Rome where one of my consultants in South Africa was telling me about a case of skin cancer from a patient who'd been bleaching their skin for a number of years. So it's not uncommon. It's definitely a risk, and it's something that we have to be mindful of. So as you can see, there's within the UK there's government regulation, and the trading standards has articles on it, and also you can quite often find articles on that on the news. So this is from the BBC, but if you do a quick Google search, you'll find many more as well. So what are the ingredients that we're concerned about, really, when it comes to skin bleaching? Fundamentally, I'm going to say there's three ones which are often reported that we can often find in these products. I haven't given you guys examples of the names of products, partly for two reasons. One, because I think sometimes the curiosity kills the cat, so people often go and look and try. But secondly, because um, sometimes these products don't overtly say or don't overtly show the ingredients that they have these chemicals in, these components in. But hydroquinone, which is a product that we use in the healthcare, prescribed and under good guidance, is often seen at doses which are beyond what we would regard as safe. Mercury is a quite toxic metal. Again, that's regularly seen in products. More in the UK, it's completely banned. In many countries, it's illegal to have it in their products. But some countries they do still have some small doses of that seen. So it's important to be mindful of where you're going and what exactly you're buying. And then super potent steroids. Um, now I've been you and I are all quite familiar with topical steroids. We've had conversations about the benefits of them as dermatologists. I rely on them often to treat inflammatory skin conditions, but used in the wrong kind of way, they can cause a lot of damage. So again, hidden in products um, where for skin lightening, super potent steroids can cause a lot of damage. Okay, so let's break it down a little bit. Hydroquinone. So hydroquinone itself is a component that can help reduce the amount of pigment produced by a certain particular kind of cell in the skin that produces melanin. Um, and really, in conditions such as melasma, we have shown that it's really effective. We know that it does irritate, so often we use it in combination with other things too. But really, it's known for a period of about 6 weeks, and that can improve the skin tone, help balance it out back to normal, back to like a regular baseline, and then we stop it and go to something else. Now, unregulated use, that is, you've bought it from the counter or under the counter, should I say, can often lead to other complications. So long-term use, I'm sure many of us in the community will have seen it. You get this kind of dark mark across your face, cheeks, around your forehead. Um, it may often be described as the Mask of Zorro sign, right? So if you guys remember the character from the movies, where you got like a black mask around your face, um, and really once that happens, it's quite hard to reverse. Alongside that, you can see this kind of redness around the cheeks, and just generally this increased level of dyspigmentation, so increased level of uneven skin tone. And these are all really the long-term consequences of using hydroquinone. So as a dermatologist, often when I see you, if you come to clinic, I can tell straight away what you've been doing. It's hard to get rid of, and I think something that we have to be mindful of. So I would strongly, probably this one of my biggest emphasis today is products of hydroquinone don't use unless you've been prescribed or they're giving you a clear instruction on how to use it. Okay. In the UK, it can only be prescribed, I believe. I think in other countries you may be able to get it, but in the UK it can only be prescribed. Okay. So mercury, we talked about mercury a little bit earlier on, but mercury is very toxic. It's the same metal that we used back in those old school thermometers. Um, it's banned in many countries, and for that, predominantly because it can cause so much trouble to the body. You know, what we worry about with mercury, because it gets absorbed so easily, is it can damage the lungs, the gut, and the kidneys. And because you don't often know it's in the product, by the time it causes those effects, it's caused quite severe, quite significant damage. And as a result, we then have to do quite significant treatments or surgeries. For example, you can have kidney failure, which means that you're not able to pass water properly, wee properly. That can have a severe impact on your life. In some very, very severe cases, mercury can affect your brain function. So your memory, you'll be able to your ability to control things properly, develop tremors as well. So it's a product that is seen in components of skin bleaching, and something that we really encourage people to be mindful of when they start trying to look for skin tone and skin bleaching products under the counter. Okay. Okay, and then the potent steroids. Now, the thing about potent steroids, when it comes to skin bleach and skin tone, is that quite often you don't see it's not always obvious in the product that you're buying. So you may have a treatment or a cream that's described as a multi-action cream or a multifunction cream, to treat everything from acne to eczema to XYZ. And quite often within that, it'll have a steroid in there. Initially, it may help with that kind of inflammation you see, and then long term, you'll get this kind of lightening and yellowing of the skin, and then in some instances, which is something you'll see, is that you'll see people who've used these kind of skin correction creams, as they may be described, having very dark knuckles and then very pale very pale areas around around the fingers as well. Um, Steroids themselves can be safe when they're used properly, and as someone who prescribes them maybe 5, 6 times a day, we always come with a good instruction of how to manage them. This is these what we describe today, things we see when it's unregulated. That's you using it without real guidance, and or sometimes unaware that it's present. So quite often, if you come to me or if I see you, you may often have the skin thinning. So, your skin looks a bit more fragile, a bit more paper thin. You may often see kind of your blood vessels a bit more obvious. Um, you may develop stretch marks. You may notice that actually you're getting bruising more often. Quite often, patients who use these kind of skin bleaching creams or skin correction creams regularly often get this kind of acne looking rash, and then that kind of leads to further hyperpigmentation, and in some very severe cases where without patients realizing they've been applying this cream around their eyelids, etc., that can cause eye issues. One that's quite severe is glaucoma. And again, that's not reversible. So it's important that when we think about skin bleaching and about these products, um, we're mindful that they have consequences beyond just the skin that you're initially trying to target. Okay. So what do you do if you're concerned about your skin? And what, is it valid to be, and what should we do about it, really? And I think fundamentally, we all, irrespective of what your skin tone or skin color is, okay, and I generally mean this, like whether you're the fairest Northern European from like Norway, or you're from the central equator where your skin is dark for some protective reasons, your skin tone is not even, okay, right? We're a constellation of pigment, right? And so aiming for this kind of this uniform um image is never really achieved unless you're using makeup or like a fake tan. That's something to be mindful of, because your cells are individual, they're alive, and they will produce pigment relative to the area that's needed. Okay. So when you have an issue with dyspigmentation or pigment imbalance, the question you have to ask is it part of you? That is it has it been there for a long time since birth, and therefore it's not really a new process going on, or has it gradually changed over time? You know. Second thing you want to know is, did it suddenly come after an injury or maybe some inflammation? So quite often, if you've had a bruise, or you've had some acne or some kind of injury, you may notice that you get some pigmentation around the area, and that's something that we often that we can treat. Often people consider hyperpigmentation as scarring. Slightly different. Hyperpigmentation does go away over time, whereas a scar doesn't. Okay. And sometimes you do have conditions where your skin goes darker without you realizing it. So this can be related to sunlight. So I've mentioned previously melasma. Um, Certain foods may lead to a rash or irritation, make your skin more sensitive. And But that's only if you've got that condition that's related to it. And sometimes your work environment can lead to what we call like an irritant dermatitis, or which can also lead to inflammation and then that kind of hyperpigmentation as well. So by understanding those problems, we can then aim to correct and to treat the underlying issue and prevent the dyspigmentation that we're seeing. Okay, so I've told you that, and I know that everyone still wants to know what to do when things like go wrong. And I think the main thing I'd say, I know that maybe some people roll their eyes when dermatologists say SPF, but SPF is good. Now, being richly pigmented or having a lot of pigment in your skin protects you from sun-related skin cancer to a degree. Okay, but everyone will naturally gets a promotion of pigmentation in the sun. So if you have scars or you're worried about kind of an uneven skin tone, then the main thing to do is wear SPF. You can wear SPF throughout the year. If you're very dark skin in skin tone, then maybe you want to use like an SPF 30 during like the winter months and then an SPF 50 in the summer months. Mineral tinted sunscreens often provide this kind of extra protection of visible against visible light, which there's some evidence that shows that it can increase pigmentation as well. But all these things are fundamentals, and you use it in your face, using your arms, use it anywhere that's sun exposed, and that can be the first line to help balance everything going on. After that, speak to pharmacists. So your pharmacist may have advice about what's going on, maybe direct you to some topical treatments you can consider. And if things aren't going right, then see your GP, and they can often, if they have any questions, they can often then lead you on to a secondary referral to a dermatologist. Okay, I want to emphasize this point. I have said it earlier on. Pigmentation, hyperpigmentation, takes at least 6 months, and that's when you do things like to the book, SPF, moisturize. Try not to irritate the area. Okay. It does correct, and I've seen some great results. But you do have to keep faith. Your skin is an organ, okay? Just like your heart, just like your lungs, etc. So just like you can't go to the gym tomorrow and be six pack ready and arms out, looking like Arnold Schwarzenegger, you need to give yourself some time for your skin to really do the work it needs to do to rebalance itself. All right, okay. So now I just wanted to, I'm sure people asking the topic in the group, in the chat about what products have been used and what can be used, etc. I'm not going to go through brands. No one's paying me, no one's sponsoring me for this, so we're not going to go there. But I will kind of briefly talk of a few products which have been effective, which are effective and can be used in combination. Okay, so retinoids are typically you can buy them at the counter as a retinol or retinal. They are a vitamin A derivative, so the come from the vitamin A compound. That's often quite good and helps with skin resurfacing, so making skin feel a bit smoother, but also can reduce the amount of pigment being produced. Okay. Azelaic acid again works slightly differently on a different area of the pathway that leads to pigment production and can help balance things out. Often retinols are used in the evening, and depending on how sensitive your skin is, you may be able to use it once a week, or twice a week, or 3 times a week, or 4 times a week. But use in the evening, and you need to use SPF in the morning because often it can make your skin a bit more sensitive to sunlight. Azelaic acid is a bit safer. It can be used throughout pregnancy, whereas retinols are advised not to be used when you're pregnant or just trying to conceive. Niacinamide again is a serum. Again, that can be bought over the counter. It's often seen in a lot of products these days, and that's right. That again, if it kind of reduces that excess pigment production as well. Vitamin C is an antioxidant, relatively safe to use. Each product you buy, there's a slightly different formulation. And the main thing about vitamin C is that you need to keep it in the dark because it's relatively unstable. So if you leave it in your bathroom or in somewhere there's a lot of light, then often it can lose its effect relatively quickly. Arbutin is another product that is a safer derivative of hydroquinone. So Arbutin is available over the counter. I think there's a few brands who do have products that contain Arbutin in. And that can be used, I think, twice a day, really, without any real concerns to the skin. And thiamidol is something relatively new to the market. There's definitely a brand that's been pushing it a lot, It does work. It takes a bit longer, but again, it has these effects that helps improve pigmentation. You often need to use it twice a day. Okay, all these products, when you buy them at the counter, they're at doses which are safe for public use, but it's so important that you follow the instructions carefully and read. And even though it's causing you irritation, it may be that you're using it too often, so maybe cut down to once a week, or maybe the way that's formulated isn't right for you. You don't need to use everything, so please don't use this list to buy. Okay, it's just giving you guys an idea of what things have been used and what things we may prescribe to patients to help with their skin balance, or suggest to patients, should I say, to help with the skin balance, pigment balance. So there's other things just to be mindful of is that no cosmetic brand will tell you that it's skin bleaching or skin lightening. It'll talk to you about post-inflammatory acne improvement, because that's what they're trying to deal with, the hyperpigmentation, so the excess production of pigment, not the reversing of your natural pigment. So that's where we as healthcare professionals try and address. We don't want to change your skin color. We just want to help reduce any underlying drivers of excess pigmentation. Okay, I hope that helps everyone. I think my concluding thoughts really for this is that skin tone and skin color has protective benefits. You know, the way our pigment is there to protect us from UV predominantly, but also from, you know, to allow us to adapt and indigenous lands. Okay, skin bleach in itself almost disrupts the body's natural defense systems and natural ability to manage its skin and manage its organ. Okay, just like you wouldn't try and alter how your heart functions, you shouldn't try and alter how your skin functions, because fundamentally your skin is an organ. It's one of the biggest organs in your body, and it's something that's so vital to keep us alive and functioning well. So be mindful that when you think about all these skin toner and skin bleaching products, they do come with unwanted and long-term side effects. Often you don't notice until it's too late, and when it's too late, it's very hard for us to correct. So please be mindful and please be careful. Don't use unregulated products. The things you see out on the shelves are often regulated. Okay, so they've gone through training standards. They are UK or EU regulated, and which means that they're set to a standard. Okay, anything you get under the counter, which you can't, which, you know, boss man's trying to give to you in a brown bag, or, you know, just not available to see, just be mindful that perhaps it's not legal in the UK or legal wherever you're going. I think it's important to seek professional advice about your skin if you're concerned about it, whether that's a healthcare professional, a pharmacist, etc., or healthcare professional, and that includes pharmacists, nurses, GPs, or specialist doctors, because they can often guide you in what you need to do. Makeup is fine. You know, just use makeup if you want an even skin tone, because, you know, fundamentally we're a constellation of cells, just like we're a constellation of people. So, you know, we're all meant to be perfect, clean, perfect. All right, okay. Now I'm going to stop there. So any questions, we can go ahead.
Thank you so much, Dr. Chiedu. That was very insightful, actually, even for myself. I've been making a lot of notes because obviously as a GP, we get people coming with a lot of skin problems, and especially when they meet a colored doctor as well, they expect you to know the answers to some of these things. So really good to, you know, to have you here with us today to touch on some of these things. And I think just fundamentally with the NHS, obviously, we know the NHS and funds and everything we hear about. A lot of these things are seen as cosmetic, and the funding and the commissioning for anything cosmetic in most areas have been taken up of. And you find patients in that difficult situation where they're just average income earners. They don't have health insurance and they can afford to go to a private doctor, and yet the NHS is not going to be able to fund their treatment because it's seen as cosmetic, and you see a lot of people stuck in the middle. So definitely for me, it's quite, it's important to be aware of some of these things and know how to advise patients as well. So really good presentation. Thank you so much. We've got a few questions coming, and some of them have been answered. So I will still read out the questions, and then the ones that have been answered, I will just say, well, we've already answered that. For people who joined us late, just because of time, the ones that have been included in the presentation, we'll try not to go into them. The presentation is available on YouTube, so you can always watch it and just to see what Dr. Chiedu has said about those things. One of the things you mentioned, Dr. Chiedu, this is my question, and I just thought to bring it up because just to clarify any ambiguity. One of the things you mentioned was about melasma. Just to break down the word for people who don't know what melasma is. Do you want to just say for yourself? Actually, I'll let you say what melasma is.
So melasma is again a condition of hyperpigmentation. So typically, often for many people, they may see it around their cheeks, around the forehead. It's often related to, it's often seen in women, and there's often a hormonal association with that as well.
Yeah.
So, some women who become pregnant may see that they develop it. It is natural, and it can just naturally go back to its normal, normal baseline. But it's something that you're worried about, then you see your GP or see your doctor, and we can manage that.
Absolutely. Yeah, I asked that because I do get patients coming after, it's usually after they've been, they've had babies, when they come for the 6-week check and so, oh, this color, I don't like it. It's changed. And I said, look, we all go through it and it will go back to its normal. But some people can have really bad ones. So would you say just leave it for that 6 months and see what happens, regardless of, what it looks like, just use makeup? Or are there, certified treatments that people can get from a professional if they do want to treat the melasma, especially the one from pregnancy?
Yeah, there's definitely treatments that you can use. It's not something we should go through today, but definitely see a GP. And I don't know, some areas we now have what's called advice and guidance or teledermatology, where GP practices can often contact their local dermatology service, who can offer some more advice and guidance about options during pregnancy and beyond. But yeah, it's something that we can treat. But often it's a one appointment kind of thing.
Okay, awesome. Are there any natural products that people can do, or any foods that you would suggest people, can eat to help with their skin tone?
Skin tone, no. I think the main thing is to have a health a healthy diet. And I mean that because your body, your skin is often is an external reflection of your internal health. Okay. So if you're not hydrated, if you're not eating correctly, then you may lead to, may develop underlying conditions that may then manifest with skin irritation or skin rashes or, yeah, etc., which can then lead to hyperpigmentation. So it's just mindful that it's not about eat something that's going to make your skin look different. It's about eat something to make sure that you're generally healthy.
Yeah, absolutely. Absolutely. Thanks for that. One of the questions that came from YouTube, thank you, was how safe are products that are bought on TikTok? Now, that has been answered in the last slide. Obviously, the question came before the last slide. So Molly, Dr. Chiedu did mention that regulated products is what we want to do. So things that you can see, things that you can buy from the shelves or ask the pharmacist. Things on TikTok, nobody knows what they are, where they're coming from. So there's no regulation and you don't know what you're using. Anything to add, Dr. Chiedu?
No, exactly. I think make sure that you can find the company and that they're regulated in the UK, or regulated, at least regulated in the country that you purchase in or you live in.
Absolutely. Yeah. Molly, I hope that answers your question. If you need any more clarity, please put in the chat and then that will be communicated to us. So another question, what's the difference between skin toning and bleaching?
I think to be honest, I think it's a way to hide something else, if that makes sense. Quite often we know kind of the stigma associated with skin bleaching. As a result, we often use the term skin toning to kind of make it feel less judgmental. Fundamentally, I think the objectives are the same. So it's being mindful of that. Now, there's skin toners, which they themselves are a completely different product which you can buy over the counter, and that's something different. So I think just be mindful. It depends on the context of the conversation that you're talking about. That where toning may lead to something else.
Yeah, I think toning is kind of more of a vague, vague statement, and it can encompass anything from bleaching to, you know, uh, making your skin more even. I think people who definitely go for bleaching are people who want to look fairer. So they would go for the full-blown bleaching just to make themselves fairer. So bless Michael Jackson. I don't know what he went through, and there's so much speculations, but if he did it for cosmetic reasons, then that'll be full-blown bleaching because he went from somebody really dark to somebody who was really light.
Yeah,
Let's assume.
I think he had vitiligo.
Okay.
I think some part he had vitiligo, which is the condition which leads to loss of pigmentation, and then I suspect he then used camouflage cream to help produce this even skin tone.
Awesome. So yeah, so bleaching it's kind of full blown going from one complexion to the other. And in the context, people usually use it skin tone is like, oh, just going to, a shade lighter kind of thing, or making your skin have its natural glow. Some people use that kind of word. But yeah, it's all changing the color of your skin, and we just have to be careful about it. On the back of that, actually, Dr. Chiedu, we usually will get darker as we age. Most people will do that. Um, I mean, it's natural, isn't it? Is there anything else we can do about it? Or we just accept this is the face of life? My skin has served me for so many years. It is that just that sure of the fact that I've lived so many years on the surface of the earth.
Yeah, I mean, it's funny. You get slightly darker, and then you get older. You actually become fairer again.
Yeah, you do.
Um, uh, but SPF is if you're worried about skin about increased pigment, then SPF. But you're not. The nature of your skin is that the sun will always give you your skin will always react to protect you from the sun. So you're getting darker to protect you from the sun. So just be mindful of why your skin is getting darker. Yeah.
Okay. Now this is a big one, and I'm just going to give, I don't know if we can go into it today. So why do so many skin lightening products target Black communities? And how is this tied to colorism and colonial beauty standards?
Uh, Um, so I think you'll actually find that it's every community, but perhaps it depends on where you're looking. If you're in the African continent, then yes, you'll get examples of African women or dark skinned women going lighter. In Asian continent, it's the same thing. It's in the Americas, again, it's very similar. Even the UK, at one point, the Victorians um, were the fair-skinned ones were ideal because it showed that they didn't work, they weren't outside, they were laborers, whereas whereas the people who were darker were the laborers who were getting the sun exposure. So there's that context there. The reality of it is that when racism and colonialism happened, the Europeans who came over would often treat the fairer skinned people a little better and fairer, and so you aspire to be that, so that you get the opportunity that the people who are fairer were. Unfortunately, media and fashion, etc., again lent towards that. So aspirationally, people wanted to be what they'll see, what they could see. Hopefully, things are changing, but it's nuanced. There's many things going on. It's from colonialism to the fact that society hasn't was only showing a certain kind of woman or certain kind of skin tone, and this hopefully is now progressing and improving.
Thank you. Thank you. Well, you answered that very, succinctly, because I was like, oh my gosh, I don't know if you can address that today, but absolutely. And it's interesting to see that even the Caucasians had that mentality as well. I never knew about that. I know obviously the African community and, people with mixed race and lighter skins were looked at as, I don't know, more beautiful or better, whatever word you want to use for it, than darker skin. But it's interesting that it was actually more of a class thing as well. So
Mm.
from the other communities, and I know it's a big thing in the Indian subcontinent as well, having a lighter, fairer skin, and the darker skin people were like the second class people. So put in that context that it was more of the fairer skinned people was, well, they were indoors and they were the pampered ones and
Mm.
everything, and everybody
Yeah.
wanted to. And I
Mm.
think it's the same as what we have nowadays with the celebrities, because they might be fairer because they're bleaching and toning, yes, but it's also because of the kind of luxurious life they're living.
Yeah,
They have people
exactly.
taking care of them. They're hardly out in the sun or anything unless they choose to. They've got spas in the house. They've got all this, beauty routines that they go through to take care of their skin. And they have, highly, knowledgeable people, helping them to look after their skin. And we on the other side don't have that much time and money. And then we want to, get that result using a short coat, and that's why people then tend to use all these harsh things on their skin. So yeah, really interesting perspective there. Thanks for shedding light on that. Can skin bleaching affect fertility hormones, or lead to internal health issues? Now we know we've talked about internal health issues with, it can
Mm.
affect the liver, kidney, and and the memory, especially with mercury. But what about fertility?
I can't really answer that because I'm not a fertility doctor. But what I would say is that if you're concerned about what you're applying to your skin and whether it's affecting your chance of pregnancy, then I'd encourage you to speak to your healthcare professional and they can guide you.
Yeah, absolutely. Yeah. Now, this is a very interesting one. So I've used skin bleaching creams in the past. I know I shouldn't have, but I wanted to at the time. How can I safely stop and repair my skin now?
I think it's uh well, it's hard to say without looking at your skin, but I think one thing is I'd say is that it's good to recognize that that it's you want to stop. Um, I think most times you are able to stop stuff, but if you need, but I if you think you've used for a long time, then maybe it's something you can see your GP about because they may be able to seek advice about what the product is and whether or not it's had like a steroid in it that may need to wean off a little bit for it. So it's good to maybe speak to have a healthcare professional with the product that you've been using so they can at least guide you along that way.
Yeah. And with a lot of these things, would there be that period of where, obviously, when you stop using it, depending on the product, obviously, the skin will have to go through its period of aging. So obviously there's going to be uneven skin, there's going to be some pigmentations, I presume, and it's going to take so many months for it to get, back to a better state. So I think it's kind of perseverance as well, isn't it?
Yeah, exactly. Yeah. So your skin, just like your skin's an organ, it needs to heal. There will be, each individual is different, but hopefully most people, if they stop any kind of those skin bleaching creams, will have a period of well, the skin will gradually get better over time.
Yeah.
But yeah, be
Yeah.
be faithful, and perhaps if you're struggling again, so you can get the advice you need.
Yeah, absolutely. And thanks for sharing that. I'm sure there's some other people that this would have affected and, haven't been able to come forward with that question. But absolutely speak to somebody, especially with the steroids, because you do need to be weaned off from those ones. Um, does using bio oil count as skin toning? I don't know what bio oil is.
No, bio is over the counter. It's quite common. It's not it's got nothing that's going to lighten your skin. It's more about um moisturizing and reducing the inflammation of your skin.
Yeah, okay, awesome. And somebody's asking, with the illegal product, is there a way of reporting?
Yeah, trading standards. The trading standards. If you go on the website, trading standards in the UK, there's a way
Yeah,
to report them. Yeah.
yeah, absolutely. Trading standards would be the place to go. And somebody's asking if you have a private clinic.
No, I'm a registrar. I'm still training.
Yeah, so not yet. Okay, awesome. So that goes to show how good the session was, and like, oh, you know, I want to speak to you privately. No, okay, brilliant. And somebody's asked about radio frequency and micro needling. That what does that mean? I don't know. Is that under this, or I don't know what that
Yeah,
means.
so it's not really these are kind of cosmetic treatments that can be done. I'm not cosmetic. Well, my real interest in dermatology isn't really cosmetics too much. Um I mean you can use them to help with like skin resurfacing, but if it's something that you want to do, you want to explore, then I just encourage you to speak to um a specialist in that area.
Yeah. Yeah, awesome. You know, when you were talking about professionals, and I find this as well, I'm not quite sure where I sit with it. You know, there's some beauticians or
Mm.
estheticians that do some of these things. Would you, I don't know what kind of training they have, to be honest, and would they be people to speak to, or it's safer to keep away from them?
So I mean, let me not get myself sued, but I would advise that if you have a skin issue, you go see a dermatologist. That's not just because we're doctors, but often we understand more than just the surface, so we understand the biology behind what's going on. Um, there's some cosmetic procedures which other people can do, and they're kind of superficial, and they, may treat some problems. But if it's something that's ongoing and chronic, then it may be a balance that you need someone who's going to give you some medical advice whilst on some cosmetic advice. So it's really about being aware of what you're trying to achieve. Some people are very good, and there's more regulation coming to the system. But as someone who has seen people who've had complications, I would advise go to a healthcare professional at least, and someone who's got real experience in managing skin issues.
Yeah, absolutely. And somebody's got question about melasma. SPF causes more acne for that person. What do you advise? I've tried different SPF and I get spots when I use them.
Yeah, so that's frustrating. I'm sorry to hear. The true answer is that you need to that there will be one SPF that may work for you. Um, Often we call it non-comedogenic, so one doesn't block up the pores. It may be more expensive, but if you um this is probably where you can go to like a cosmetic counter. They may often know what kind of cream or kind of a SPF is better for avoiding pigment spots and acne.
Okay. And this person's also asked, is it normal for a person who is fair to start getting dark spots just on the face only?
Yeah, you mean like yeah? So we all get them. So I think you're talking about these kind of it's basically it gets more small spots as you get older. They're fine. It's called small skin tags.
Yeah.
We get them as we get older. It's very common. Yeah.
I was going to say you need to look at my face.
Yeah.
My son is always asking me, "What's all this black spots in your face?" And I think because you're fairer, isn't it? It's more obvious. I'm sure the
Yeah.
darker skin people
Exactly.
also have it, but you
Yeah.
just don't see them,
Exactly.
isn't it?
Yeah.
Okay. And there was a question about mercury in tooth filling. Yes, there is mercury in the tooth fillings that we have, but it's not just mercury. They have other metals in there as well, and it would have been put in, in a safe proportion, I suppose. And they're more cosmetically accepted tooth fillings now, so they don't look like when people open their mouth and you see weird colors, then they're now other colors that people can use. So yes, there is, but it will be the level. The thing about skin bleaching or skin toning and mercury is you've got a large surface area you're applying this to. You're going to do it over some years, and it accumulates in the body over time. In the tooth, I'm sure they must have done the research to see what level will be there, and it's not going to get absorbed. It's just going to be in the tooth anyway. So yeah. Is that okay? Do you want to add anything to that?
No, completely. Yeah, it's all regulated, so it's done in a safe way.
Yeah. Okay. Thank you for the question. So there's so much more. Uh, uh, okay. So there is some more questions on here. Let me just have a look. Uh, Somebody else, do you have a private clinic? We said no. And okay, I think Sam has kindly put all the questions together for me. So oh, thank you, Sakina. So very enlightening. Thank you, Dr. Chiedu. Gen Z is under immense pressure to gain social acceptance, and so much so that they feel they need to tone down their true skin selves to fit in. Absolutely. There's so much pressure these days on social media, isn't it? We want to look a certain way, we want to, be seen to live a certain way and things like that. And it all comes from us being confident in ourselves and, whatever, just present ourselves to the world the way we are, not the way we think the world wants to see us. So I think that's all the questions. Sam, is there anything I've missed?
No, there isn't, Dr. Falake.
Just a quick one, Sam. I just
Yeah, go ahead.
seen this one from Biba. Did I hear you say that you can be dark as you're aging and get fairer later? Yes, absolutely. So we're born a certain skin tone. As we get older, people will get darker. Generally, not everybody, obviously. And after a certain age, we start to get fairer. And I guess that has to do with our activity levels as well, Dr. Chiedu, isn't it? When we're younger, we're outdoors, we're doing more things. When we get to a 60, 70, we're hardly outdoors. We just want to chill out in somewhere nice and shady and, so. Yeah. Thank you. Right. That's it. Anything else you want to add to that, Dr. Chiedu? Anything else that you...
Yeah, I think we've been quite comprehensive today. So.
Yeah, it's been really good. I really enjoyed listening to it. And sorry, Sam, back to you.
No, it's fine. Thank you very much, Dr. Falake and Dr. Chiedu. It's been an excellent session today. I've learned a few things. I've used bio oil in the past as well, so I was like curious when you had the question asked. I was like, oh no, I hope I'm not being accidentally bleaching. But yeah, no, it's good to know that over-the-counter stuff is the most appropriate way to use these products if we do need to do anything related to our skin. So there, thank you very much again for giving up your time this morning to educate us. And thank you, Dr. Falake, for hosting today's session. I'm just going to quickly go through a few slides of things that are going on within CAHN. And please just bear with me and feel free to ask any questions in the chat or click on these links to register. I'm just going to share my slides and I'm just going to go through this presentation very, very quickly. Just bear with me. Sorry, guys, my laptop's moving a bit slow this morning, as expected to do something. The system starts going really slowly. Okay. Just going to share my screen. So the first thing I'd love to tell you about is next week we'll be having another health hour session, same link, same time, different doctors this time around. We're going to have Dr. Diane, and she's going to be talking about tackling developmental delays in Black children. I think this is a very key topic at the moment, and I think everyone that's on today's session, please feel free to come along, share with your friends and family, and yeah, let's learn something new. I'm going to be there. I'm going to be there tuning in, so I look forward to seeing you guys there too. So the next thing I'd love to talk to you about, I've put the links in the chat as well. So if you want to register for any of these things, please click the links in the chat. Our Black Healthcare Awards is happening just a few weeks away, just 2 weeks actually from today's date. We're going to be celebrating Black healthcare professionals. We know that they're the backbone of the NHS and the healthcare system here in the UK. So we wanted to create an awards day, an awards night rather, dedicated to celebrating our community. The first one was last year where we had over 500 people attend and over 100 people got recognized for their hard work that they've been doing over their lifetime and over the work that they've done in their various sectors. So we have this year, we have categories like junior doctors, we have healthcare researchers, we have dentists within these categories. We also have Black Students of the Year within the medical field. So we have a variety of categories. If you just go on the website, you see all the categories listed out there, and we look forward to you coming along to celebrate with us and the communities and those that have been shortlisted. If you probably see us on social media, we're sharing and we're talking about people that are shortlisted. There's a lot of people doing great work in the healthcare industry, so it's important that they are celebrated. That's something that's really part of our culture as a Black community. So please come down, get a table, get a ticket, come with your friends and family, come with your colleagues. It's going to be a great fun night. And also practice your candy dance, because we're definitely going to be doing that at the end. And I'm going to be taking part in that too. So if you see me, do come and say hi. The next thing I'd love to talk to you about is our upcoming Black History Month civic launch. This is happening in the Cathedral in Greater Manchester. It's going to be a fun evening. Last year we had various people coming from schools, from different backgrounds, coming to celebrate Black History Month. In the UK, we celebrate Black History Month on October, and we want to launch that event or launch Black History Month by just having it a little bit earlier before October comes around, so that everyone's geared up and ready to celebrate the Black achievements of people across the UK and across the country and across the world as well. So please feel free to register. It's a free event. It's happening on the 25th of September from 6:30 to 9 p.m. and it's going to be at the Manchester Cathedral, just as I mentioned at the start. So one of the last few things I want to talk to you guys about is the call for evidence for reproductive equity and fibroids. As you know, there's a fibroid crisis going on, and there's not much research, there's not much data when it comes to fibroids, especially with fibroids affecting 80 to 90% of Black women at some point in their life, which is quite a scary statistic. So we have put together this link where you can come and provide evidence, whether you're a researcher or you're a lived experience individual dealing with fibroids. We want to hear from you. We want to put together a package where we could go back to the Parliament for the APPG and Black Health. Through that, go back to the Parliament and get them to write some policy and actually make some headway within healthcare or make some headway within the pharmaceutical industry, where fibroids are actually an issue that's tackled, because it affects fertility, it affects not just people's livelihood, but it also affects their ability to go to work, so that it affects how they contribute to the economy. So it's a socio-economical issue, not just an individual issue. So please, if you do have any experience with fibroids or you know anyone dealing with fibroids, please do provide some evidence, as we would like to change this inequality, because yeah, it's quite terrible, and it's quite heartbreaking hearing the stories of many women who go through this experience. If you're based in Greater Manchester, if you're in Bolton, we have a Green and Arts wellbeing service that happens in Bolton every Wednesday, and also in Stockport every Tuesday. So please feel free to come down, connect, create some art. We're a very self-expressive community, whether that's through art, dance, singing. This is just another avenue where you can come and express your creativity, learn how to do some crocheting, learn how to do some different textile arts. If you have any questions, please do contact Green and Arts at CAHN.org.uk or call Ola at 077-899-75205. And if you'd love to create art, if you want to be part of this as well, please do reach out to us, and we look forward to seeing you at one of our hubs, either in Bolton or Stockport. I just want to say thank you very much for listening to this presentation, and also for tuning into today's session on skin toning and bleaching. We do appreciate your time, Dr. Chiedu, and we do appreciate your time, Dr. Falake. This has been a very crucial session. As Sakina mentioned in the chat on Zoom, Gen Zs are feeling a bit more pressure to try and fit in however they can. And that's one way, by skin bleaching and skin toning. So we're glad that you were able to provide us with actual knowledge of how to get through these social pressures and avoid these quote unquote social norms that celebrities are trying to push their agenda by, skin toning and skin bleaching. So thank you for providing all the information. If you guys want to catch up, please visit our YouTube page. This video will be there. And yeah, have a wonderful rest of your afternoon. I look forward to seeing you at the Black Healthcare Awards.
Thank you, everybody. Thank you, Dr. Chiedu. See you next week.
Okay, right.
Welcome to our Caribbean and African Targeted Health Improvement Programme, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.